Evening, everyone. Welcome to our presentation tonight of a Q&A and a small presentation about vaccine protocols and questions. My name is Darren Muma. I'm the COO of Swim Ontario, and I'd like to introduce our two subject matter experts for tonight. Roberto Gignoni from Borden Ladner Gervais in Ottawa, and Aaron Durant, who's the principal of ED barristers who are Swim Ontario's lawyers. Welcome. And I don't know who would like to start, but let's go from there.
Hi, everyone. Thank you for joining us tonight. I'm here to talk about a very interesting and difficult topic that's certainly going to be top of mind for a lot of you, which is vaccination mandates and vaccination passports. As you'll know, Swim Ontario just recently released their vaccination policy, both for their own staff as well as for Swim Ontario events. So I'm going to talk today a little bit about those policies to start, but then also give you some information that might be helpful when you're administering these policies and potentially your own policies on the front lines. With some common questions that you might have or have received from members. I'm going to focus on employment law and human rights issues because those are the areas that I'm more familiar with. And we brought Roberto in to talk about privacy law issues, which are also an important subject here. I'll start by saying that it's been a busy 2 weeks for me talking and giving advice on these areas as a result of the provincial government's vaccine mandate. As you know, there was a regulation that came into effect with fairly short notice that applies to amateur sport, in particular indoor sport, and it applies to individuals under the age of 18 involved in those sports. What we've been seeing across the province, both with swim clubs as well as other sports, is that different facilities are implementing the rules in different ways. And some of them are adopting more strict measures than what the provincial government requires. And quite a few facilities have decided to basically treat everybody 12 years of age and up as requiring a vaccine, notwithstanding the fact that the regulation itself is under the age of 18. So that's what I'm seeing across the province. The other thing I'm seeing across the province with multiple sports is that the owners of the facilities, the municipalities, the universities who are renting the facilities, are often downloading the responsibility of making sure people are vaccinated to the people who are renting the facility themselves. So unfortunately, that's a lot of volunteer clubs, and it's a lot of work for volunteers to administer. I would have thought that the preferable approach would be for the property owners to take on that responsibility, and some of them are by putting a person at the front door, for example, checking vaccine passports, similar to what you see in restaurants, but not everyone's going about it in that way. So we thought it would be a good idea to give this information session, knowing that a lot of the Swim Ontario member clubs are likely getting questions from their participants. They might have questions even among their own board. So we're trying to share as much legal information as possible. Even though Roberto and I are both lawyers, we're not here to provide individual legal advice today. So although you're free to use the Q&A part of the program down at the bottom by sending in a message to the chat, we ask that you keep your questions general. We're not able to answer any case-specific information today. So please do submit your questions. And if they are too specific that we can't answer them on here, it's not that we're ignoring you. It's just we can't give legal advice in front of a venue with so many people on it. And with that, I'm going to share my screen, assuming I can get the technology working. And maybe I'll ask if Roberto could give me a nod if he can see the screen. Good, and you can still hear me? Double good. I'm already well ahead of where I was earlier in the week. So for my part of the session, I'm going to start by just giving a general overview of Swim Ontario's policies and clarifying a few areas where we're already getting a few questions from clubs and members. I'm then going to move into a couple of areas where I'd like to clarify some legal issues for you to give you some very general legal information that might help you in answering questions from members and participants of your clubs and of your events. The two main legal concepts I'm talking about are the Canadian Charter of Rights and Freedoms and the Ontario Human Rights Code. I'll talk briefly about the duty to accommodate individuals who may not be able to get vaccinated due to a medical reason, and the types of ways that you could potentially think about accommodation, and also the evidence you can request when accommodation is asked of you. And I'll give you a few key takeaways on these issues before I hand it over to Roberto. So you should have received an email, and you would have noticed on the Swim Ontario website that there's two policies posted. The first one I'm not going to talk about in too much detail. It's Swim Ontario's employee policy. And this policy simply applies to all Swim Ontario employees, and it's giving them notice that they're required to be vaccinated within 6 weeks of them receiving the policy, and that employees have to be fully vaccinated for at least 2 weeks before being able to participate in activities or job duties that require any sort of physical interaction, really with anybody involved in swimming and with their colleagues. Again, that requirement is subject to Swim Ontario's obligations under the Ontario Human Rights Code, which I'll talk to you about in a little bit. So this policy has come into effect. So, your members don't need to be concerned about, if they're attending any Swim Ontario event and there's going to be Swim Ontario staff there, they can be assured that people are going to be fully vaccinated. And it's my understanding that this policy has been well accepted within Swim Ontario, and it was endorsed by the board. The policy that you are all likely to have more familiarity with and will need to be familiar with yourselves when answering questions from your teams are the provincial program policy. So this applies to provincial teams and provincial events. And I'll do one point of clarification right off the top. So when Swim Ontario talks about provincial teams, it's talking about literally the provincial teams. So people that are selected to represent Ontario in provincial teams. It's not talking about, an individual swim club team. So if there's an individual swim club in Ottawa that, is just participating as a swim club, this policy doesn't have to apply to that club. The club's free to adopt its own vaccination policy, but this policy is simply meant to apply to anybody participating in Swim Ontario teams or provincial level events. So I won't read all of the circumstances and all the events in which it applies. So if you have athletes that are going to be attending any of these Swim Ontario specific events, those individuals will be required to be vaccinated, and it applies to athletes, volunteers, parents, other participants and attendees. So basically anyone who's going to be attending with the athlete at those events are going to have to be vaccinated. And for this, we've set the age at 12 and over. And again, a lot of facilities that Swim Ontario and member clubs are going to be using are going to have similar restrictions. Some of them, it may be 18 and over. Some of them are using the 12 and over. It's really depending on the venue. So that's the provincial program policy. Again, there may be people subject to exemptions, such as for a medical reason why they could not be vaccinated. And again, they're able to submit proof of an exemption for that to be the case. And we'll talk a little bit about what that proof might look like in a minute. So those are the big high level policies. Individual clubs are free to do what they wish in terms of their own policies as well. If you have swim programs that aren't competitive programs and you have athletes coming into your club, and people wish for the club itself to have a vaccine policy, you could always look at what Swim Ontario has done and tweak it to suit your purposes. Ideally, any tweaks would be reviewed with a lawyer, volunteer, perhaps, that's involved with your club. The main thing that you want to make sure you don't tweak on your own are the requirements that there's exemptions due to the Human Rights Code, because it's important by law to make sure those exemptions do exist. But it might be something your club might think about having, and it's possible that if your club doesn't have its own policy, that the venues that you use might have a similar policy. So I'm moving into a couple areas where people have a lot of questions, either based on things they've read on social media, things that they've heard from friends, things that are just floating around in the public discourse about vaccines. And I don't like calling people anti-vaxxers. It really polarizes society. And I think a lot of people that don't want to get vaccines have a variety of different reasons to do so. Some people are simply nervous. Some people just don't have access to the same information as other people. And I like to try to take the approach of talking to people and trying to explain why things are the way they are. And that's how I'm approaching this today. I'm trying to explain the law to you in basic terms so that hopefully you'll be able to pass on some of this to your members if you get pushback, or at least so that you feel comfortable that what you're doing is on side with the law. So on the human rights side of things, I hear two different things frequently. The first is, getting a vaccine violates my Charter of Rights and Freedoms. The government can't make me do anything I don't want to do. The government can't force me to put a needle in my arm and get vaccinated. And you may even see reference to Section 7 of the Charter of Rights and Freedoms in particular, which is the section that says everyone has the right to life, liberty, and security of a person. So this section has been interpreted by the courts over time so that the government or anyone can't force you to have any sort of medical treatment against your will. But what the government has done with the vaccine rollouts and with similar rules in society is that they're not going to force you to get vaccinated, but they are going to restrict your ability to go certain places, participate in certain activities if you're not vaccinated. And the justification for that is they are trying to control this worldwide pandemic. They're trying to keep people safe. And that's the justification for it. And there's all kinds of rules in society that the government puts in place to keep people safe and that restrict our liberty in some sense. And it was interesting for me to see last night on Twitter, where I'm quite active. There's a well-known Canadian human rights lawyer named Paul Champ, who's also based in Ottawa, and he's typically seen as being very pro civil rights, civil liberties. And he's very much in favor of vaccination. He's very much in favor of everything that the government's done. And his response to individuals who say, for example, well, why am I getting vaccinated? It's still possible to get the virus. His response to that was simply, well, it's sort of like saying, why can't I drive drunk? People who drive sober get in accidents too. It's sort of the same thing. So, I sort of like that, because the government has the ability to protect people in society. It's not just something that they should do, it's something that they're required to do as part of a functioning society. So this idea that the provincial or the federal government are taking away rights and liberties is not something that's substantiated by law. There's no successful court case that says that. And that's simply a bit of a, I don't want to say a red herring. It's simply something that's not true and that's been spread across the internet, and that your members may hear and may come to you with. The more frequent issue that comes up is the issue of the Ontario Human Rights Code. And this tends to come up when you have a vaccination policy that might go beyond what's set out in the government legislation. So we've gone over already what the Swim Ontario policies are. They're pretty much the same and mirror what the government does in the case of participants, with the main addition being that they've lowered the age of that requires vaccinations to 12 from 18. And so vaccination policies that go beyond government legislation have sort of two different parts and two different outcomes. One are for participants and one is for employees. And you have to treat those two groups of people differently, both because of human rights considerations, but also for employment law. So if you have a bunch of participants, volunteer coaches, volunteer officials, you have a lot of flexibility in terms of changing your policies. No one has the right to be a volunteer. Volunteers can come and go as they choose. They're not going to be losing any compensation by not being able to volunteer. So you have a lot of freedom and a lot of leeway to change those policies. When you're changing policies for a paid employee, things get a little more complicated because paid employees have employment contracts. It's my understanding that swim clubs often have independent contractors where they're called independent contractors, but they may possibly be classified as employees. So these individuals are covered by the terms of their contract, and you can't just cancel an employment contract and nothing happen in most circumstances. So when you have a new policy that you're rolling out, the best thing to do is to provide people ample notice of the change. In Swim Ontario's circumstance, we decided to go with 6 weeks. Depending on the circumstance in your club, you may want or need to go longer than the 6 weeks to give the notice of the change. After the notice is given, and if people decide not to get vaccinated, you have to make a choice as a club. And the choice might be that there's a way to accommodate the person so that they can still do work for the club. But it might not be possible to accommodate the person if the time runs out and they don't get vaccinated. And unless they're not getting vaccinated for a reason that's protected by the Human Rights Code, you're not actually required to accommodate them. You can try your best, you can find them something to do, but you'd be free to fire them. Now the question becomes, what do you do when you terminate the contract? And if you're terminating somebody's contract because they're not getting vaccinated, I would strongly encourage you to consult with your own lawyer about that, because the circumstances of the termination are really going to depend case by case and what's written in your contracts. It's possible in some circumstances that you might be able to argue there's been a termination for cause. More likely, what a lot of lawyers are suggesting is that you need to give people notice of the termination and potentially pay them out under the terms of the contract, but it's really going to depend on what's written in that contract. So if you have a coach or another staff member who's not getting vaccinated, you don't want to keep them around anymore, there's nothing else you can give them to do, you may need to consider termination. And in that case, I'd suggest you talk to a lawyer to help manage that for you. So both in the employment context and in the volunteer participant context, the provincial human rights legislation applies. And what the provincial human rights legislation is in Ontario is the Ontario Human Rights Code. Similar legislation exists across the country. And it only protects discrimination on the basis of certain enumerated grounds. And the two grounds that you hear about most often in the cases of vaccines and mandatory vaccinations are disability, which includes a medical condition, and religion or creed. There's other enumerated grounds such as family status, sex, gender, gender identity that don't come up in this analysis. But the one thing I will say is there are several different ways that you can treat people differently in society. It doesn't protect you from, if I didn't like Roberto's blue shirt and I had a rule where, we're having a party, only people with red shirts can come in and Roberto shows up in a red shirt, a blue shirt, I could say, Roberto, you can't come to my party. And Roberto wouldn't be able to say Aaron's discriminating against me because they have the wrong colored shirt. And that's kind of how the Ontario Human Rights Code is looking at, people who decide not to get vaccinated just because, they've done their own research, or they're not comfortable with it, or they just don't like the government telling them what to do. It's not discriminatory to deny somebody something on the basis that, they just don't agree with you, so to speak. Then I'll get to that a little bit. So, next slide here. Helpfully, the Ontario Human Rights Commission released a statement just this week or late last week dealing with this exact issue and how they're going to treat alleged violations of human rights. So the Human Rights Commission has a tribunal where people can make complaints to if they feel like their human rights are being violated. And this is a policy statement basically outlining how the Human Rights Commission is looking at this issue and what their thoughts are. There hasn't yet, to my knowledge, been a case make it all the way through the Human Rights Tribunal system to an outcome yet in Ontario, mostly because the Ontario Human Rights Tribunal is incredibly behind and nothing's happening there because of the pandemic. But there have been decisions that have come out this week and last out of Vancouver and some of the other Western provinces that have clearly found that it's not a breach of human rights to require people to be vaccinated to participate in certain activities, especially if there isn't any reason, such as a medical reason or a religious reason, why the person can't be vaccinated. So we're getting some good law out of the Western provinces on that. So I don't like reading from slides, but basically what it says is that, well, receiving a COVID-19 vaccine remains voluntary. The Ontario Human Rights Commission takes the position that mandating and requiring proof of vaccination to protect people at work or when receiving services is generally permissible under the Human Rights Code, as long as protections are put in place, make sure people who are unable to be vaccinated for code-related reasons are reasonably accommodated. This applies to all organizations. Upholding individual human rights while trying to collectively protect the general public has been a challenge throughout the pandemic. And organizations must attempt to balance the rights of people who have not been vaccinated due to COVID-protected grounds such as disability, while ensuring individual and collective rights to health and safety. So when you're doing the balancing, and when more importantly, the tribunal is doing the balancing, it's thinking of the health and safety of society as a whole, and wanting to protect society as a whole, and that aim, that goal, is important enough that people can put restrictions on things and require vaccinations. So we've talked about exemptions, we've talked about accommodation, and I'm going to dig down into that a little bit because this is where a lot of the practical questions come out. So it's possible that people may not be able to receive a COVID-19 vaccination for a medical or disability related reason. And under the code, you have a duty to accommodate those people unless it would significantly interfere with other people's health and safety. So this is a complicated one in the context of sport, and how it will play out really depends on a number of things, including, the venue, including the number of people involved, including in some instances that the other people involved. And if you're dealing with people who have other underlying health conditions and would be at risk with being around an unvaccinated person. The number of reasons why doctors are able to give an exemption note, a medical exemption note, are quite low. And there have been a couple doctors just this week who've been disciplined by the regulatory body for writing medical notes that aren't really backed up by science or medicine. One of the reasons I've seen were people who had a severe reaction to the first dose of the vaccine. It might be wise for that person not to get the second dose right now until, there might be other options available. But the number of medically accepted exemptions are quite low. So you shouldn't really be seeing too many of these, although it is possible. Sorry. Another thing to consider is whether or not accommodations will be possible once you get the note, and that can be a bit complicated. For most swim activities, it might be possible if you have a small number of participants in a large pool. It might be possible to accommodate people by spacing them in certain ways, restricting access to certain parts of the facility might be another possible accommodation. But it might also be possible that the accommodation's not possible, because there isn't really a way to make it work, safely, depending on who your participants are, what your facility is like. One example that comes to mind for me, and it might be an extreme example, but you might have either a volunteer coach or a paid coach who's involved with coaching, like a seniors club, a group of people over the age of 50 or 60, for example. Those people are higher risk at contracting the virus. So in those cases, you might have to wonder, okay, is this possible? Is this safe? And again, if you're getting requests for exemptions due to the duty of accommodate for a medical reason, and you're not sure, it's okay to ask for advice on that. It's okay to go for help. On the Swim Ontario website, on the FAQ that I helped put together, at the very bottom of the FAQ, there's a list of 3 or 4 legal resources that are available to not-for-profit organizations that provide free legal advice. So Pro Bono Ontario is the best one. They have a hotline you can call, and they'll answer questions, and they're available to answer questions on things like this. And again, lawyers that might be part of your club are also another great resource of people who might be willing to help. And of course, there's always Roberto and I, if you can't find someone who's willing to help for free. But those free resources aren't very well known, and I highly recommend it because they're staffed by some of the best lawyers in the country. Roberto works for the largest law firm in Canada, and their lawyers volunteer at that service. So I would highly recommend going there if you're unsure. The other exemption, I guess, before I get to this slide, that you might see are religious or creed-based exemptions. Those ones are worth taking a closer look at if you get them, because most of the mainstream religions that most of your members would be members of have stated, publicly that they have no issues with vaccination, including the Catholic Church. There's been some people who have made the point that the the vaccine has been tested on certain stem cells, for example, and that could violate potentially the Catholic Church teachings. The Catholic Church has said no. The Pope himself has made a statement on that. So when you're looking at religious exemptions, you're able to ask questions, of people. You don't just have to accept their word that this is against their religion. You can ask for details about the religion, ask for details about the doctrine that applies. The Ontario Human Rights Commission has said quite clearly that simply the belief that you don't believe in vaccination or you're against vaccination doesn't count as a creed or as a belief that is exempt from the Human Rights Code. So you don't have to worry about that. And again, just like the case of exemptions for a medical condition, if you're unsure, this is hard. We've never had to go through something like this before. All not-for-profits are struggling. It's okay to feel like you need to ask for help with something like this because it's not easy. And I know that most people involved in this sport are volunteers. So just a few points before I turn it over to Roberto, and I'll be available after if there's questions that arise for both of us. But first point, you have to make sure that your swim club is following the provincial government vaccine mandates. Your members need to be encouraged to only enter the facilities that you're renting if they're vaccinated, unless they fall under the exemption of being under the age of 12. Swim Ontario members are required to follow Swim Ontario policies. So if you know that people are going to be attending the Swim Ontario events or trying out for the Swim Ontario teams, they're required to follow Swim Ontario's policies. And if they don't, and if it's found out that people are intentionally violating them or fabricating false documents or anything like that, there's penalties, both under provincial law as well as under Swim Ontario policies to discipline people that don't follow it. Again, you might be asked to make accommodations, if they produce evidence of a medical condition from a doctor or a registered nurse, or a similar professional, and if it's a legitimate request for accommodation, you have to consider if you're able to do so up to a point of undue hardship, and you're able to request the evidence for that. So I'm just going to stop sharing my screen here, and before I'm just scrolling through to see if I have questions that I should answer at this point or whether I'll share it at the end. I think save these questions because they're good ones, and I'm gonna save them till the end, and Roberto and I might be able to address them at the end of the presentation. So I'm seeing them, but I'm gonna raise them with Roberto afterwards, just because some of the questions about evidence, collecting evidence, does have a bit of a privacy aspect too. So Roberto, I'll hand it over to you for now.
All right, hello everyone. Thank you for being here. So I'm Roberto Guignone, and we're going to talk about privacy and start with talking about what is privacy, what does that mean? Because I think everyone it's a topic that's frequently in the news. There's a lot of talk about rights to privacy, and want to explore what that actually means, for clubs that are operating teams, who are renting facilities, who are trying to enforce the provincial guidelines and any vaccination policies that are put in place. And so we'll start with sort of a general overview of privacy, and then sort of slowly move into talking about applying the privacy principles to the actual issue, which is vaccine passports and vaccine policies. I'm going to share my screen. So I have a slideshow as well. If it all goes well, everyone will see it soon. Okay. So we'll start with talking about privacy legislation. So the right to privacy is something that has been recognized in courts and recognized in legislation. And it's something that has different meanings at different times, in the sense that you don't have an unfettered right to privacy, and that in order to access things in society, you have to share personal information about yourself. You have to get medical care. In order to access that medical care, you have to share personal information. If you want to purchase something, you have to share some personal information. So it's a right that's a bit relative to the things that we're doing and the things that we want to do. And the starting point for looking at sort of what privacy rights are is to look at the legislation. And in Ontario, there's a patchwork quilt of legislation that applies differently to different organizations. And so there's public sector laws that apply to public sector organizations and those funded by the Ontario government, such as municipalities, hospitals, government agencies, that type of thing. You have the Freedom of Information Act, the Municipal Freedom of Information Act. And those might apply to some of the facilities that you rent from, if they're universities, if they're municipalities, that type of thing. And then there's also private sector privacy laws. And in Ontario, there's a bit of a gap. So there's a Personal Information Protection and Electronic Documents Act, which is a bit of a mouthful to say, but this is a federal act that applies to businesses engaged in commercial activity. So this applies to companies when you go to the grocery store, so the information collected by Loblaws, or information collected by other retailers, by banks, by large businesses that we interact with, but doesn't cover sort of not-for-profit organizations. And the only other sort of privacy law applicable in Ontario, there's a Personal Health Information Protection Act, but this one is really targeted towards organizations and individuals that provide healthcare. So it provides rules that apply to those, but doesn't necessarily apply outside of that context. And so it protects medical information, but not in every context. And so what is privacy? And it's defined in different ways. And it's sort of, can be the right to be left alone. So, the most sort of obvious example is the right not to be sort of spied on when you're in your own house or your own property. The other way it's used, and the way the legislation comes out, is the right to know, how, if you're going to disclose information, why you're going to disclose it, how the person you're disclosing to will use it, and how long they're going to keep it, what's its purpose. And this is sort of where the privacy laws come in, and where the privacy principles that underpin sort of Canadian privacy law come from. So just as a little bit of a, comment on the legislation. In Canada, privacy legislation comes from 10 privacy principles that the Canadian Standards Association put out. And they put out sort of a model piece of legislation. And most privacy law that has been enacted has taken those principles into account into coming up with the legislation. And they're important principles that for your own clubs, you can also take into account. We're going to talk about on the next slide the most important ones in the context of the vaccine. But before we go there, I wanted to sort of summarize what privacy laws, privacy policies, that the principles that guide them are going to be consent and reasonableness. So you want to make sure in a situation where you're obtaining information from people that you obtained it with consent. And this is a situation where, as Aaron mentioned, participating in swimming, participating in sports, it's something that people volunteer to do. No one's requiring anybody to participate. And so everyone that comes to your club, comes to your events, is there because they want to and because they want to participate. And the other part that is to take into account is reasonableness. So it's to make sure that the information and that's sought and that's needed is what's actually reasonable for the purpose. So which is why if you go into a grocery store, you don't have to disclose your address, which if you're buying something from Loblaws, you don't need to tell them where you live and things like that. So what I'm going to move on to now is to talk about the key privacy principles that apply to one, putting together policies and privacy policies, and the other part to actually implementing those policies. The first key principle, and the one that's one of the most important ones, if not the most important one, is consent. And what consent means in the context of privacy is being able to have a discussion or an explanation with the person you're getting personal information from to know what specific information you need from them, what you're going to do with that information, and who you're going to share it with. And it's particularly important in the case of a vaccine policy in order for people to know and be comfortable with knowing who's going to use it, how it's going to be used. And the other important part is with a consent-based approach, which is what everyone would be applying, is when it comes to using information or it comes to keeping it without consent or without explicitly stating why keeping something, you can't use it for a purpose. And this might come up a bit later when we're talking about putting in a vaccine policy, but where you may be going to an event with your club that's out of the province. And so maybe at the beginning of the season that wasn't sort of contemplated, and there may be information that needs to be shared with that, especially about vaccine status these days, with that out of province entity or organizer. And so if that's not one of the things that you've sought consent for at the beginning, it's something you'll need to ask your members again before sharing any information. The next key principle is to limit collection. So it's to obtain only the information you need for the purpose that you need. And this is quite important in the case of a vaccine certificate or vaccine passport, as the documentation provided by the Ministry of Health has a lot of information on it that we don't necessarily want shared with them. For example, we don't want our health number to be shared as individuals. And for an organization that's putting together a sort of vaccine policy, you don't need individuals' health numbers. You may not need to know the exact dates that they obtained or the exact type of vaccine that they obtained. And so the goal with sort of all the principle is, one, only obtain the information you need. And the other reason to do it is you don't want to have too much information that's not well protected. And I think everyone might have seen that, this week there was the vaccine passport app based out of Alberta, which was basically had, people's driver's licenses and Nexus cards and health cards unsecured on the internet for anyone to find, in this case, CBC to find. So the more information you keep, the more risk you have, especially if it's information that you actually don't need to keep. The next key principle, and the one that you want to apply as once you've collected the information, is limit use and disclosure and how long you keep things. So by limiting use means only allow the people that need to have access to personal information to have access to it. So if you're keeping, a vaccine status list, don't necessarily make it on a shared server, but perhaps limit it to the people who can have access to it. And for disclosure, it goes back to the consent, but limit the people you're going to disclose it to, and avoid sort of sending emails around, as that type of privacy breach has happened as well with various employers implementing vaccine policies. And the last one is to have safeguards in place. So make sure that whatever personal information you collect and whatever vaccine information you collect is protected. If it's electronic, that you've got it in sort of secure devices and that it's not necessarily widely available to others outside your group or outside the key people that need to have it. Or if it's in paper form, that it's maintained in a secure location, sort of a locked filing cabinet or a locked office or somewhere where there's access controls to it. And all these things will go a long way putting these in place to avoiding any risk that comes with privacy breaches or ransomware or any other of the risks that come together. And everyone is always more satisfied with privacy policies when you understand them and know what's going to happen with them. And so this moves us into sort of the key issue we're here to discuss, which is what's reasonable, what's necessary, and why, what can we do with vaccine policies and vaccine passports? And with privacy, with everything, there's a balancing of interests. So in this case, there's, everyone has a right to privacy, a right to their own personal information. And there's the public health interests on the other side of, and the occupational health and safety, and occupiers liability type interests, where as an organizer of an event, as a swim team, there's a duty to keep people safe, the duty to put together a safe environment for participants, coaches, volunteers, and spectators. And so there needs to be a balance of interests. And in the case of swimming and in sport, the balancing is further considered by whether it's an essential or non-essential activity. So an essential activity would be, for example, receiving medical care, where putting a barrier where you have to be vaccinated to get medical care would result in significant harm to individuals, versus putting up a vaccine policy that to require participation in sport can lead to unhappiness or strong feelings, but won't lead to serious consequences for an individual. Similar to sort of comparing going to the grocery store versus participating in sport or going to sort of eat inside at a restaurant. One you need to do and is sort of necessary for society, the other isn't. And so where you're dealing with a non-essential type activity, there's a lot more balance of the interest with reducing a bit the privacy right and putting more onto the public health and safety aspects of it. The other important part to consider in this circumstance is you're collecting information directly from individuals. You're not in a situation where there's a lot of background or indirect collection of data, either through, one example would be a surveillance camera that's up that indirectly collects a lot of personal information, or the things that our tech giants have been getting into trouble for, which is kind of keeping reams of information about all our habits and all our clicks. And so when putting in a policy and then putting it in place, it's thinking about what do we need to do to fulfill the purpose, which is what do we need to do to make sure that our public health and our occupiers and our safety is put in place. So we'll start first and talk about vaccine passports. This is sort of a newer item and one that you're going to face more frequently in that it applies to all indoor recreation facilities. And where it comes from, in the place where the reason that this is in place is because Ontario passed an act called Reopening Ontario, a flexible response to COVID-19. And this is an act that sets out sort of the roadmap towards eventually sort of lifting public health restrictions. Right now, we're in step 3, which is why there's a regulation called the Rules for Areas at Step 3. And one important part sort of is that there's a general rule or general obligation for organizations. And that's to make sure that everyone operates in accordance with applicable laws, including the hard one to say for some reason, Occupational Health and Safety Act and the regulations under it. And this has been in place for a while. And while under pandemic terms, not sort of for years and years. But what's recent is there's been an addition to it. And this is sort of section 2.1. And this is where there's the person responsible is sort of the organization. And it's not specific to just incorporated businesses or other things, but covers broadly any sort of organization, is to operate in compliance with advice and recommendations from the Chief Medical Officer of Health or from any local medical officer of health. And we know that sort of some different regions, for example, New York and Toronto, have started to put more restrictions on things than even sort of the province has in terms of what proof of vaccination is required and for what age groups. And so there's an importance of keeping in mind what jurisdiction you're in and what is required for that one. And what this overall requires is having a policy on COVID vaccination. And it sets out specifics of what organizations need to do in order to comply with the vaccine passport. And so before we look at what those actually are, the purpose of the passport right now, and this is distinct from vaccine policy, the purpose of the passport is fairly limited. It's really to keep control over who goes into enclosed indoor spaces where you're likely not to have masks on. So it's really the vaccine passport as passed by the province is kind of setting an in or out requirement for who can go into buildings or out of buildings. And there are some exemptions in the legislation. And one of them is for individuals that are under 18 who are participating in the sport or practice or activity. So for the provincial requirement for vaccine passports, individuals under 18 who are going to a facility that is covered by the regulation, so an indoor pool, and there's no other rules that are in place from the local medical officers of health or from the organization you're renting from, may be able to come in if they're not vaccinated, if they're under 18 and participating in the sport. What this does mean, though, is that a sibling who's not participating in the sport but wants to watch won't be able to come in, or an unvaccinated parent won't be able to come in with them. And so it can create sort of a difficult sort of situation at the door. So that's one to sort of think about. And the other is the sort of exemption that Aaron discussed, which is the medical note. And the regulation actually specifies who can give the medical note. So it has to be either a registered nurse, a physician, or a nurse practitioner. So other specialties, other individuals such as physiotherapists or occupational therapists or other types of medical professionals aren't able to give a note to an individual that you can accept. So that's one of the things, if you're looking at an exemption, you are able to ask for proof of it. And you should check, who is the person who gave the exemption to make sure that it's part of and consistent with the vaccine passport legislation. And this is one of those cases where normally you're not able to ask necessarily for medical evidence for things. And for masking exemption is one of those things that is clear in the mask legislation that you can't ask for medical evidence of an exemption. But there's a difference for the vaccine passport. And so that's where Suri can point to specifically in the legislation why that needs to be seen. And vaccine policies, though, can have broader purposes. And what's on screen are just small excerpts from the Swim Ontario policies. And there's just a contrast with the sort of vaccine passport's purpose, which is really just to limit entrance to certain facilities, versus the vaccine policies have a broader purpose where it will regulate, contact between team members and team events, not just inside indoor facilities, but also elsewhere. And so this is where and we'll talk about it when we go into what it means for collection and use of information. You have to think about, when you're sort of implementing these policies, what information you're going to need and why you're going to need it. And in terms of implementing the policies, think about, how are we going to do this? How are we actually going to collect information? And so this is where we're going to get into sort of how do we apply our privacy principles to the collection and use and potential disclosure of this information. So for the vaccine passport, which is our sort of door check, that legislation is fairly clear. You don't retain proof of vaccination, and you don't retain proof of the medical exemption. So this is really meant to be a show your ID, show your proof at the door, and then walk in. So in terms of how to set this up efficiently, one is to make sure that whatever volunteer individual is doing the door check, that they don't have to record who's coming in, what time they came in, or what proof they provided. But it will be important just for your own process to have a written process written down for how that volunteer is going to do that check. So there's the Ministry of Health has various sort of frequently asked questions, which kind of have pictures of, here's what the vaccine certificate from the province looks like. Here's what sort of the acceptable ID. Here's where to look for things. And the idea is to have a practice in place that your volunteers will follow. That way, if down the line you're ever asked, did you actually do this? You can say, here's my practice. Here's what we trained our volunteers on to do, and here's how they did it. The other thing to think about when putting in the vaccine passport scheme is you may be operating out of facilities that have multiple venues there. So you may be renting out one of them, and there may be other places that people can go different places, sort of a large community center, that type of venue. So in terms of where you want to set up sort of for the vaccine passport, you'll want to try and choose a spot where you can, it doesn't necessarily have to be at the exterior of the door if the individuals coming in aren't only coming to your events, but somewhere where you can control access to who's going to the pool or who's going to the locker rooms, and kind of set up so that anyone who goes past a certain point has to show proof, and then you can sort of control access that way. When it comes to vaccine policies, and so for the vaccine passport, the key is set it up physically so that it's easy to do, and make sure the person is trained on what to look at. And so that one, and don't keep any information from it. When it comes to a vaccine policy that you're implementing for your members or your participants or volunteers or employees, then what you want to do is you are going to need to record people's vaccine status. And so you're going to need to verify vaccine status. One thing we don't recommend doing and don't suggest is a good idea is just to collect sort of everybody's vaccine certificate printed out. One, you're going to be collecting more information than you need, and health numbers and all sorts of other things. And depending on how large your club, that can turn out to be a whole lot of information about people that isn't necessary for the purpose, and if it goes missing, could be problematic. So one easy way to sort of get around that is to choose a trusted individual or other sort of a few trusted individuals who can visually verify a participant's volunteer's vaccine status and note it down next to their name. So they write it down, say vaccination status checked and approved. And you keep that list which says, person, you can even say when it was checked or the time of day it was checked and by whom. So that way you have a list of who's complied with the vaccine policy without actually keeping any personal information about that individual. And can remind and put in your policies that individuals may be required to show this at future times, and you can ask for it again in case you ever needed it or if there are questions. And this will give you the information you need to make sure that you've got a secure, safe environment, but without keeping too much information. And when it comes to sending information to other organizations, you may need to ask for consent, or you may think of ways to, if you're negotiating for going into a tournament and that tournament wants proof of vaccine, you may be able to ask to sort of redact certain information from the vaccine status certificates that's not going to be necessary, such as health numbers and other things that aren't going to be helpful. And with all of these, it's letting all your members know why it's being collected and how it will be collected. And with all these things, and with sort of vaccines and the pandemic and masking and everything, we've seen that there may be conflict to manage. There might be questions, there might be issues to work through. One key part is, and one thing Aaron mentioned, provide advance notice. Let everyone know what the requirements are, make them very clear, and answer questions about them. One thing that you could do to sort of make it easy at the door, and depending on where you are, there's a risk that people's cell phones are going to die. People might not have, have been able to remember their printout version. And so you can think about whether you want to have some kind of internet connected device that if people forget something, they can just go on and sort of pull up the Ministry of Health website so that they can show their vaccine passport. So if someone forgot their phone, they're not necessarily stuck without being able to come in or something like that. And depending on who your members are, you may know that they're vaccinated after a while. And depending on the facility rental requirements and how things are structured, you may be able to sort of figure out a system to make it easier for everyone to get in and out of the building while respecting the vaccine passport requirement. The other part is where there is sort of difficulties with members of the public, participants, volunteers, you probably have already practices and policies that address everyone being civil to each other, everyone avoiding any kind of harassment, threats, and things like that. And so rely on those.
I'll just interrupt Roberto there just
Please.
quickly because I'm familiar with the Swim Ontario policies. So as most of you on the meeting will know, Swim Ontario does have a code of conduct and discipline policies that apply, and those policies do require basically everyone involved, to treat each other with respect and not harassment and without threats of violence. Your clubs may also have similar policies. Certainly, the venues would have as well policies that apply to protect their staff. So, you absolutely should not be putting up with any sort of threats, any sort of harassment, swearing at volunteers. This is hard enough for your organizations to deal with. So, if you're getting situations like that, don't be afraid to utilize those policies and to go through just the discipline and complaints process, just as you would if there was an incident at the pool, beside the pool, at the pool deck, in terms of people, not being respectful to each other. So do keep those in mind, and it is a tool that is available and that I expect a lot of sports, might have to use from time to time, unfortunately.
And of course, with all of this comes patience, and sort of it's going to take some time for everyone to get used to. Sometimes it'll be easy, sometimes it might not, but patience, I think, will get most of the way through. And in exceptional cases, as the sort of organization that's in control of the premises, that's rented it, or depending who you're renting from, there may be either security on site or the ability to simply remove people from premises. And if worse gets to worse, there's your rights under the Trespass to Property Act to have people removed by calling the police. And ideally, that situation never arises, but there is an option in case there are sort of confrontations that are if people sort of refuse to show a proof of vaccination and come in anyway, that's the way to remove them. So a final note on sort of this idea that it's a violation of my privacy to ask me about proof of vaccination. And the thing with privacy is it's not a violation to ask about these things. And it's not a violation because the person you're asking doesn't have to answer you. They don't have to give you their vaccination status if they don't want to. At the same time, what there flows from that are consequences. So if you show your vaccination status, you can come in. If you don't, you have to stay out. And that's the truth with many other things that are involved in sport and safety and most places. We have to be close to go into grocery stores. We have to sort of wear certain helmets or certain equipment in order to, go on the ice in municipal facilities. So it's one of these where this is one where you can ask, and if someone doesn't answer, then consequences can flow from that. Hopefully this will go smoothly for everyone, but we're happy to take questions that have come up.
I'll answer a couple questions that came in directed to me that were in some ways related to what you said too, Roberto. And while you were chatting, I did insert into the chat for everybody else just a few links that I found helpful in preparing and that lawyers are consulting. One is the link to the Ontario Human Rights Commission's statement, which has some good information, and then the others are links to Swim Ontario documents. And the Swim Ontario FAQ in particular is something that may be updated from time to time, and perhaps even after seeing some of the questions come in today directly from the clubs, it gives me some ideas of frequently asked questions that people on this call may not have. The most common question, not surprisingly, is about exemptions and dealing with those practically. You're the people who are going to be getting the requests, and you're the people who are going to have to make a decision about exemptions. One question that came in is, can we just have a policy that we're not going to accept any exemptions ever? That wouldn't be a best practice in my view, in light of the Ontario Human Rights Code, because the Ontario Human Rights Code and the Ontario Human Rights System recognizes that there are going to be people who require certain accommodations. And in the case of a medical exemption, it recognizes that people who can't do something for a medical reason should be treated differently than somebody who just doesn't want to do something because they don't believe in it. And, people with disabilities need to be accommodated. Whether it's a person in a wheelchair who needs access to a building, you need to have a way for them to get in. Same thing with people who might have a health condition that restricts them from being vaccinated. One of the most frequent ways that people with a legitimate medical exemption to COVID-19 are being accommodated in the workplaces, and Roberto may have more details on this since he works for a very big workplace that deals with this often, is encouraging the use of COVID vaccine rapid testing technology. So those people could be required to take a rapid test, show a negative COVID-19 result from that test as a condition of going in and participating, and be required to do that each and every time they enter the building. In addition, you can think of other possible restrictions, such as not using the showers, and masking carefully, and distance and lanes from other swimmers. Roberto, do you have any other ideas for accommodations that have come up in either your other presentations at BLG or in discussions with employers?
I think the antigen test is sort of one of the most common ones, and the frequency can depend on what kind of environment the person is going into. Are they going to be around other people en masse? Are they going to be around sort of distance and separated from others, or other things like that? And so you can think about the frequency of that. The other common was distancing and masking, to make sure that's in place. And I expect that sort of your local public health unit would be able to provide some guidance as well, in terms of the risk that may come depending on your specific population of individuals and who might be interacting with them. And so you might have be able to, if you have a specific sort of question about what's my infectious disease risk here, I think your local public health unit would be able to provide some assistance on that ground. But yeah, it will depend on, is the person going to be masked or unmasked? You might already have health screenings as part of it, as submitting, what people sort of, are they experiencing symptoms or other things like that. I think that's the sort of approaches you can take to it, and figure out whether or not you maybe need to sort of, if it's practice time, maybe you need to shift the practice time for individuals with a medical exemption that can't be masked, and give them space as well.
All of this is up to the point of undue hardship too. So, each club is going to have different circumstances, different access to pools, different times available, different members that need access, different numbers. So what accommodation looks like, I think, would vary widely between clubs based on your own situation, really. The antigen test is a really easy way, to do it, because it's testing, that they're reasonably reliable. It's what's often being used in various workplaces. I think the using those tests are becoming more trusted. So you're really going to have to look at your own circumstances and what options are available to you, because it might not be possible for you to find full time specifically for certain groups. You might only have one member, for example, and does it make sense to rent an entire session for one member, or is there a way to incorporate that person into your existing time slots in a safe manner? So it's not easy, and that's why I did suggest some of the free resources if you are getting these requests. Question came in, which is a good one. And there's a lot of information going around about what is and is not allowed under the provincial regulation that just came in terms of exemption. And I want to make clear that the only provincial exemption from the provincial government is for the athlete involved in the activity that is under the age of 18. So coaches, parents, siblings of that athlete are not exempt. It's just the athlete, his or herself, that is exempt. And the Swim Ontario policy for the provincial competitions, provincial teams, is exactly the same thing, except we've dropped the age group to the under 12. And another question just came in, which is a good one. Facilities as well can decide to be more restrictive than what the Ontario government has decided and have their own policies on vaccination. So if a facility wanted to drop the age limit to require vaccinations to the 12 age, people 12 and over, they're free to do that. And it's my information that some of the larger municipalities are planning to do that, if not have already done that, as a way to encourage people to be vaccinated in that 12 to 18 space. So yes, facilities and clubs and provincial associations are able to come up with more restrictive policies, with the only exception being that there needs to be a method of accommodation, as we've discussed. Questions about CREED. I sent a link in the chat about the Ontario Human Rights Commission statement on exemptions based on religion and creed. And it's quite forceful and powerful, in that the Ontario Human Rights Commission, is basically saying, we're not accepting this as an example of a creed, in layman's terms. We're not accepting that someone's belief that they don't want to be vaccinated or they don't believe in vaccination is a creed. So I don't think you're going to have much issues with creed, and I would rely on that document and on that statement with requests about creed. With requests about religion, again, the Ontario Human Rights Commission document and the Swim Ontario FAQ document has some details about that. The most common exemption that could be a legitimate exemption would be the medical exemption. And as Roberto said, the regulation itself has instructions about what a proper medical note would look like. If you need a refresher on what that looks like, we've included some details about that in the Swim Ontario FAQ under question number 6. And as I said, this FAQ is a living document, and I may well decide to update it a little bit after tonight, and in light of some of the questions that Swim Ontario has been getting about paid coaches that I talked about earlier, and how to deal with those requests, and the requests that you guys are getting on the ground in dealing with these things. For Roberto, and it's more just me bouncing an idea off you. If I were a swim club, how I would go about ensuring my members are vaccinated would probably be either to have the head coach of a group or a head administrator of a group, have everybody bring their information on one day and kind of privately check vaccination status, keep a record of it, and advise probably the president of the club or somebody similar, of vaccination status, and then for all of that information to only really be in the hands of one person within the club. Does that kind of make sense as a best practice for you from a privacy perspective?
Yeah, it makes sense from a privacy perspective. You may need, depending on the size of your club, you may want, one or two people depending on it. But I think that limiting the number of people that, have access to it or see it is important. And it may be, you have two coaches that can do it, one for a certain group and one for another one, depending on that. But I think that's a good approach. And, the other messaging is for wherever you go, these days, you're likely going to need proof of vaccination with you. So, you don't necessarily need to show it to the club, other than that one time, but remind people these days it's one of the things that's important to have on you or available. And so,
and I think that's going to be important for people that participate in competitions and other venues, other meets, other jurisdictions. Each individual jurisdiction, each medical officer, each municipality, in addition to the provincial rules, are able to create their own rules. And I know when I was at Roberto's firm, it could be a big pain trying to keep track of all the rules in all the different jurisdictions for clients that operate everywhere. So I think it's a best practice to be telling your members, your parents or athletes, that they should always have their vaccine passport information and photo ID with them. And I think over time, it's going to become second nature. It's already getting a bit more familiar to me because I need it every time I go into a restaurant. I need it every time I go into an office building, every time I go to the gym. So I think that people are going to start just having it on them. And, there's going to be initially some growing pains and some questions for sure that unfortunately your volunteer organizations are going to have to deal with. But over time, I think it's going to get better. So like I said, the notion of accommodation is an important one to think about, and making sure that if you do have somebody who presents a valid medical note from a medical doctor, registered nurse, the type of individuals that I've listed in the FAQ under item 6, that you think of ways to accommodate them while keeping others safe. The rapid testing is great because you could have them take it if you want each and every time before they come to their training session, and they have to present a negative test to enter. And if they don't, then they can't enter. So that's how I would deal with the medical accommodation. If you have more questions about that, or if you're getting overwhelmed with medical exemptions that you think aren't valid, that's when I would, consult with legal counsel or try to find a lawyer in your community or in your club that might help you out on that. But that's really the only way a club could sort of get in trouble with this stuff is, by not considering accommodation options. And if there is someone with a legitimate medical issue that, that gets restricted access, that's kind of the only type of legitimate type claim I could see really arising. So that's the one you need to look out for. And I'm getting some more specific questions about particular employment contracts, which I can't answer without seeing the term of the employment contract. So, if there are employment contracts with coaches who aren't vaccinated, that's when you're going to need to get legal advice based on what the contract says. And and things like that. So I can't answer those questions today. Somebody asked if a health card is a proper form of identification. That's a good question. We don't recommend using health cards for a variety of reasons. But I don't know whether I need to dig into them too much. You know, if that's the only photo ID that the kid has and it's going to restrict them from entering, take a look at it as their photo ID, but don't keep a copy of it and don't take down the health card number. Ideally, I would use another piece of photo identification, but if a health card is all the kid has, you know, you don't want to bring the passport to the pool and get it soaked, you know, that I'd accept it, but don't keep the number. Roberto, is that how you would treat health cards too?
You look at it, yeah, because for some people, that's going to be the only sort of form of identification they have available to them. And that's you know what you're going to need to go with. But exactly, don't take a photograph of it. Don't keep, you know, particularly the health number and those parts of it. But I think if that's what someone has, you know, we're going to have to. That's one of the things that I think is accepted under the sort of guidance from the Ministry of Health, because it is one of the things that individuals under 18, especially kids, is one of the only forms of ID that everyone will likely have.
About traveling out of the province. With traveling, there is likely going to be restrictions coming soon or that already exist for certain airlines and for travel by train that you need to be mindful of. There's also going to be different restrictions based on where you're going. So, you know, traveling to different countries, most places are imposing different vaccination requirements that you're going to have to look into depending on what country you're going to. Same thing with different provinces. Each province in Canada has different rules about who needs to be vaccinated for which purpose. So for travel, it's definitely based on where you're going. In terms of payment for rapid testing, there's a few different options there and a few different legal perspectives on who pays for the testing. It's possible for not-for-profit clubs to actually apply to get a stash of rapid testing from some local ministries of health, and other charitable not-for-profit organizations have access to those. For individuals who are medically exempt, it's possible that those individuals are running into this as an issue regularly and may have access to their own testing supply. And other things that people have been doing, in particularly not nonprofits and other organizations, is they're banding up with other similar sized organizations to potentially buy their own stash for their own emergency use or whatever. But being able to buy in bulk is an option as well. So there's a few different options in terms of getting your hands on tests. Clubs issue their own photo ID with a birth date. Good idea, but the regulation itself specifies the types of photo ID, I believe, right, Roberto? So I don't think that would work. The examples of the type of ID also include a birth certificate. So for kids, you could accept a birth certificate, a passport, and again, the list of types of proof that are accepted are found in the FAQ document under section number 5. Okay, so we're getting pretty close to the end. I'm going to probably update the FAQ next week if Darren will allow me to, just to incorporate some of the excellent questions that we got tonight, as well as to deal with some things that came out in the FAQ, since it's been published. You know, if you have other issues that aren't addressed here, or if you have very specific issues about particular employment contracts, you know, if you're considering having to terminate an employee because of, you know, them not being able to enter the pool facility due to, you know, the government regulations or anything like that, that's when I would really recommend that you reach out and get some help. And the FAQ document that's on the website and that I posted in the chat has 3 different resources that where you can get some free advice, hopefully, starting at paragraph number 13, which is on the 9th page. So don't be afraid to ask for help. This is complicated stuff, and unfortunately, you know, due to the way some of it's being administered by the province and by the facility owners, you know, some of it's falling onto volunteers. But you know, I'd like to thank Swim Ontario for inviting us out to do this. You know, I work with a lot of other organizations, and none of them have been this proactive in terms of, you know, getting 2 lawyers here on a Friday night and paying us to give you some help on this. So thank you, Darren, for having us. And is there any other questions you had? And do you have an issue if I do a little bit of tweaking to the FAQ based on any of this?
Absolutely, we should. I just had one question for Roberto, based on what you said about mask exemptions. I know the law states that if somebody has an exemption for vaccine, they're required to show it. I'm also, and please correct me if I'm wrong, under the impression that if someone has an exemption for mask wearing, they're not required to show it, but a facility, organization, club may ask for it. And if it's not provided, then they have the right to refuse service. Is that accurate?
I think I have to look at the regular, and I think it depends on I think, and I haven't looked at specifically the different facilities for certain things, like for municipal run facilities, for example, and is what I was referring to. There's not an ability for sort of the municipality to ask for proof necessarily, but when it comes to your own organizations, I think, Aaron, you might probably know this. I think there's a further leeway that you can go versus sort of a public space versus something that's more in private control, which would be sort of a swim organization.
Yeah, it's my understanding that you would have that ability for masking, but it's another one of those laws where it depends where you are and what you're doing. So, you know, in the FAQ currently it says that you know, for if people are contesting wearing a mask, you know, that you're able to ask that question. But that's something I'll double check just to make sure it's completely accurate in light of Roberto's discussion as well.
Thank you. And thank you both for your time tonight. It was very, very informative. And I know that we are keeping track of the questions. And Aaron, if you have a list that you haven't answered yet, we can work on them next week. If you like, we can update the FAQ when you have time. And Roberto, we may call on you for some other advice to our FAQ.
Certainly.
Okay.
So thanks for having us, and best of luck everyone managing this. And like I said, I think it'll be painful at first, but you know, over the next couple of weeks, people are going to see this everywhere, and it's gonna get better. So hang in there, and again, don't take any abuse from people. You know, if anything happens, you know, make sure that you're using your resources and you're using your policies, because you know, the last thing we want people to do is be abusing volunteers.
Thanks very much, everybody. Have a good weekend. And remember, any specific questions can also be addressed to me at my email, and I'm happy to consult with the legal team to answer them as need be.